Hey everyone, welcome to our last Ed puzzle of this class, HSAM 2400. I just wanted to go over last week, this week, and take a look at our quiz from last week. Remember that this week our class ends on Friday, the 5th. Your new classes, assuming you're taking 8-week online in the second 8, do begin on Saturday. So just be sure that you're on top of that and ready to go with your classes starting on Saturday. And more than likely your classes will run Saturday through all the way through to the following Sunday. So starting on, let's see, bring up my calendar here and I can tell you. So the class is starting on the 6th, but then the final day of that week will actually be the 14th, because that's the end of that first full week, typically, is the way we manage that. So last week, let's hop into week 7. So last week we had some specific ethical issues dealing with various legal legal trends or policies or laws that exist, looking specifically at ethical issues associated with them. So we looked at the EMTALA and some ethical issues associated with various EMTALA cases. And then we did have our quiz and our Ed puzzle. But the biggest part of last week was the final project. So, looking at the final project and getting that together and getting that submitted was probably the bulk of your week. If you didn't get an opportunity to watch the drugging dementia video, I would suggest taking a look at it. It's another good example of what is legal isn't always ethical, and definitely not ethical in that case. This video is about an organization, not just a single organization, but in general, organizations that when you have a patient with dementia, they can be difficult to deal with at times because there's so much confusion. Sometimes dementia patients will become agitated. They're certainly not meaning to cause harm to people, but could if they get very agitated. So some organizations, some long-term care organizations, take the tact that they will just drug them, provide them pharmaceuticals to kind of not knock them out entirely, but kind of just make them incoherent, and then they don't have to deal with the issues associated. And is that really the quality of life we want our patients to have in our long-term care facilities? So really interesting, kind of an investigative journalism type piece about dementia patients and what is technically legal because they're drugs that are being prescribed by the physician for these issues, but where from an ethical standpoint, where does that lie? And taking a look at that. So if you didn't get a chance last week to watch that, I really would encourage you. It's less than 15 minutes long, but really interesting kind of investigative journalism on that topic. This week, we're just going to look quickly at a case study, and you'll do some answers secondary to that case study in our discussion this week. So this is a religious discrimination and racial harassment case. Really interesting. Lots of we're looking at it from the legal aspect. How did the workers at this organization how did they discriminate against folks, or how did they harass people, and what about the actions of the HR director in particular in dealing with this situation? So interesting. I look forward to hearing your thoughts on that. We do always have an optional, well, not all courses, but most of our courses have an optional feedback discussion board. There's no points associated with it, but you can just share some information about the course, what you liked, what you didn't, those types of things. We also have our quiz and then this Ed puzzle, which will appear there. So let's take a look at the quiz from last week. So first question, healthcare organizations are expected to provide patients with diets that, so, as the answers are detailed here, sorry, I'm having a little trouble focusing today for some reason. Answers detailed on here, that meet their individual requests. Well, unfortunately, no, we can't always meet patient requests, especially if the patient requests a cheeseburger or a piece of cake or things like that when they need to be having a healthy diet based on their condition. High in fructose, no. Inconsistent in nutritional value, no. So our appropriate answer, we need to provide them, from a legal perspective, we need to provide them with diets that are prescribed, accurate, and monitored based on the needs of that patient. So that was our correct answer there. Medication errors can be decreased by, so our top two answer and our bottom answer clearly not accurate. We don't typically handwrite much anymore, so using felt tip pens or ensuring handwriting is illegible would be inappropriate. Writing ambiguous orders would be inappropriate. We want to make sure orders are clear. But writing abbreviations according to hospital policy would be important, and especially when you're talking about medications, because medication errors, when you're talking about medications, there are, a multitude of different abbreviations, and each hospital will have its own set of abbreviations that are acceptable in their medical record system. So that is an important way that we can use to decrease medication errors. Next one, allied health professional responsible for the treatment, management, diagnostic testing, and control of patients with cardiopulmonary deficits is the. So think about, and unfortunately, they're kind of the unsung hero of the COVID pandemic, but think about who is taking care of these patients that are, day in and day out, taking care of these patients that are on ventilators in hospitals suffering from COVID, and that's the respiratory therapist. So, nurse practitioner, PA, they may pop in to see them if they're having some hand in managing their care, but the respiratory therapist is the one that's really there to manage that pulmonary side of the house, especially when you have patients with significant pulmonary issues, like we see in COVID patients. So, respiratory therapist is our correct answer there, and that's it. So that's all we've got. As always, feel free. I think most of you have certainly had class with me in the past, but in case you haven't, please feel free to reach out if you were to need something. You may be in one of my classes in the next 8 weeks as well, but I am here to help out if you need something, moving forward. It's been a pleasure working with everybody. I did see some new faces here this time, so although most of you I think have been in class with me before, there was one term when someone else taught the HSAM 1275 class, and I think that perhaps maybe some of you were in that. So, but please feel free to reach out if I can do anything for you. Good luck in your next 8 weeks. Stay safe, stay healthy, and we'll see everybody in class this week. Thanks.